We will not advise surgery for anyone who drinks alcohol every night on long-term tranquilizers and sedatives, because no matter what you do, the results will not be as predicted. For those patients who are not on any of these risk factors or predisposing causes to obstructive sleep apnea syndrome, the surgical approach is multi-level surgery. Multi-level surgery refers to surgery of the nose, oropharynx, and base of tongue. One has to identify the areas which are narrow and treat these areas at the first surgical procedure. If the patient has hypertrophic or large turbinates, we reduce the turbinates. We operate in the oropharynx or in the throat to widen and stiffen the soft palate. There are numerous techniques. Every day there's a new technique, but some are reproducible. If there are enlarged tonsils, you do a tonsillectomy. If the soft palate is floppy, we do a uvulopalatopharyngoplasty with or without a radiofrequency or a coblation approach towards stiffening the soft palate. We also try and reduce the size of the base of the tongue, either by coblation or in the extreme case, we surgically reduce the tongue base with lasers, with coblation, or with robotic surgery to excise the lingual, tonsil, and tongue base. All these surgical procedures can be done, but the single most important factor is if the patient is obese, the patient must undergo a weight reduction program, because a significant loss of weight will reverse a lot of these obstruction of the upper airway, and hence you get a much better result for a patient who is actively involved in the management of his obstructive sleep apnea syndrome. There's no single pill to erase snoring. There are also lots of products on the market that claim to reduce snoring. I'm a bit doubtful of its long-term efficacy, but definitely if a patient has obstructive sleep apnea syndrome, there's no pill, topical nose spray or topical throat spray to help reverse obstructive sleep apnea syndrome.